So we want to start at the bottom of the ribs, that's where your thoracic spine starts. There's a few different ways you can do this. You can find a particularly tender sore spot and then extend over that spot. Take a deep breath. Get a little bit further, all whilst keeping your core sort of firm and tucked in. Extending over that spot further and further. You can advance this a bit by taking your hands overhead and forth like this. An exercise called open books. So lying on your side, hips and knees at about 90 degrees, starting in this position. And we're going to open up, back and forth. Trying to keep your hips level with the ground. A common mistake is sort of doing this one. So opening up as you go over, you want to keep them glued together as best. Routine for upper back thoracic mobility. This can be helpful for people with pain in this sort of region, in the joints and muscles through there. It can also be helpful for those with ongoing shoulder issues who are lacking some thoracic mobility as well. How well your upper back moves dictates how well your shoulders can move, so it's important to keep up your thoracic mobility. Imagine doing anything where you have to reach your arm out, so your arm can get there. The better you can rotate through your upper back, the better you're able to use your shoulders. So this is important, anything where you're potentially having to punch or throw. Swimming is really important as well. I'm going to exaggerate this here, but if I'm really hunched over and stuck in that position, this is as high as I can get my shoulders. If I can extend better through my upper back, I'm going to be able to get my shoulders to move further.